Okay, and we're live.
And
Yeah?
we are going to stick to English, right?
It can be a mix, no problem.
I think the presentation I'll just do in English.
Okay, sir. As it's convenient for you.
स्लाइड्स में है ना, और अगर किसी ने सवाल उर्दू में पूछा, पंजाबी में पूछा, तो उसका जवाब फिर पंजाबी या उर्दू में ही आएगा.
ठीक है, definitely. So we are live right now. We're just waiting for a few guests to join in, and once people join us and confirm that they can hear us and see us clearly, then we'll officially begin.
ठीक.
Yeah, I'm getting viewers. Assalamu alaikum, everyone. If you could please mention in the comments that you can see and hear us both clearly. Thank you so much. Okay. Yeah, I think people are really excited for this because I'm getting views quickly and a like as well. Yeah, I think we are good to go. Okay. So
you got guests on now?
Yeah. Assalamu alaikum, everyone. This is Rida Zainab from Creative Kenya House, and joining me today is a very special guest. Let me just tell you about his expertise areas. He is a specialist in child development, its disorders, and pediatric neurodisability. He is also an expert in child protection and child public health, contributing to the promotion of multidisciplinary working in developmental, behavioral, and neurodisability pediatrics in Pakistan. He also teaches and trains pediatricians and is also involved with allied health professionals. We have Dr. Suleman Daud Khan. Assalamu alaikum, sir. Thank you so much for joining us today.
Walaikum salam. Thank you for having me. It's really nice to be live with your guests.
No, this is amazing. And the topic we have for today is sleep problems in children, and it's a hot topic. Many parents are interested because many complaints we get is कि हमारा बच्चा सोता नहीं है या हम क्या करें क्यों नहीं सो रहा. So I think this is going to be really interesting. Should we start with the presentation? Do you want me to add it to the screen?
Yes, sure. Just to say by way of background that it's quite a different kind of topic for a pediatrician to talk about. But in my 40 years of doing pediatrics, I've come to realize that this was sometimes the unsaid problem, which most parents remember just as they were about to leave the consulting room, because sometimes they thought that there was no real solution to these problems, and secondly, they thought it was maybe not so important. But in fact, over time, we've all realized that children who cannot sleep well or who do not get enough sleep over the 24-hour cycle actually have such profound effects on their development that it's one of the important areas that we must concentrate on as developmental pediatricians in advising parents. So that was the reason that I started to think about it. And then I went on to this little bit of session, and I've also got a little guide for parents, which I think you've already shared, Rida, on the and it's available for parents.
Yes, it's available. Definitely, I will also put up the link in our comment section so that everyone can have access to it.
Sure. Okay, so I think if I can get this to work.
No, yeah, I'll just add it to the screen now, and yeah, we're good to go.
So the question is, in talking about sleep, I think it would be useful to have a common understanding of what sleep is about. And in this respect, knowing about the normal physiology of sleep, in other words, what is the function of it, how does it come about? I think knowing how children's sleeping patterns change over time, from the time they're born to the time they become adults, is quite crucial for parents to know, so that they can adjust their expectation of how much their children should be sleeping and when they should be sleeping. We'll talk a little bit about some common sleeping problems, and if your audience and our guests want me to talk a little bit more about particular conditions, then I've picked four main conditions: children with autism spectrum disorder, attention deficit and hyperactivity disorder, cerebral palsy, and Down syndrome. And I've picked that mainly because although children in general have sleeping problems, a third of them often have it. But these particular conditions, anything up to about 80% of the children have got difficulties with sleeping. And lastly, we'll spend some time in talking about management of sleeping difficulties too. So, where do we start? Time is the best time of the day. And if you look at this, and when I went looking for its reference in the Quran, I found this excellent notation in Surah Furqan, which is that, and He it is who maketh night a covering for you, and sleep, and maketh day a resurrection. And there's no doubt that the morning time is the time that light enters our eyes and sets our brain alight. And then during the course of the day, we are most productive. And as the sunshine diminishes, the melatonin kicks in, and it's time to go off to sleep. And if we follow this rhythm, then most of our brain neurotransmitters and our brain physiology, as well as our body, works well. So inevitably, from coming from a doctor, you're bound to see some pictures which will look a little bit gory. Essentially, if you look at the day, you'll notice that it says inhibition. So what this means is that the daylight entering through the eyes inhibits the production of melatonin. Now, melatonin is the main sleep hormone, and people would have heard about this. And what this does is that it turns off this sleep-inducing hormone in the brain. And ignore all the other medical jargon in this picture, but go on to the night, and you'll see that there is a green arrow which says stimulation. So what happens is, as the day goes on and nighttime comes, the darkness then switches the melatonin on. And this is what allows us to then slowly drift away into nice, relaxing, rejuvenating sleep. So this is an established fact. There are many other hormones that are effective as well, but the melatonin connection and the melatonin switch is the main one. Just a few things to say about how sleep is beneficial, and I don't think this is going to be a surprise for anybody, but important thing is that it maintains the normal balance of the brain activity. So the neurotransmitters in our body, in our brain, are put in balance because of sleep. In the morning time, our body temperature drops, our energy losses are reduced, and our sympathetic activities increase, muscle tone decreases with sleep as well. And then we have the production of growth hormone, which in children is responsible for their stature. Cortisol secretion, which I'll speak a little bit more about later on, gives us the energy to cope with our day, to gives us and runs a sort of a diurnal course. In other words, going very high in the morning and then slowly reducing. And then melatonin secretion that I've mentioned, and skin and tissue repair as well. So a lot of benefits which we know about. I mentioned the diurnal secretion. So what this means is that it's a twofold. It's a two peak secretion, and if you notice the yellow curve going up, the levels of cortisol and or corticosteroids in our body start to rise just before Fajr, and keep going up, and around 7 or 8 o'clock are at their peak. And then in the morning time, right until about 12 o'clock, midday, the levels start to diminish. So this is the time which is the most productive time. And this is the time during which we can do most hard work. We can face a lot of challenges. And then as the levels fall, we can go into a more relaxing mode, and the levels start to rise again around 3 o'clock in the morning. If you look at the bottom line, you'll see that accelerating activity and then decelerating, then winding down, physical repair, and so on. So this is how the cortisol, and if we go along with this cortisol function in our daily lives, we are actually maximizing the efficiency of our brain and our body as well. And again, don't try to understand to get too much into the chemistry over here. But remember, the bottom green ones, growth hormone, very important for cartilage growth, for blood glucose, for bone and tissue growth. So for the growing child, this is extremely important. And those children who cannot sleep appropriately, they end up with short stature. So it's important to be cognizant of this.
Okay.
This again looks a little bit complicated, but if you follow this blue line, essentially what it's trying to describe is that we sleep in 90-minute cycles during the course of the night. And we go from very early light sleep in the what is called the NREM1, which is non-REM sleep or non-rapid eye movement sleep. But essentially, you go from very light sleep into the deep sleep, which and the if you look at where this cycle goes up into this golden area, that's the period where we have most of the repair and rejuvenation taking place. And the thing to remember about these sleep cycles is that if we wake up and the sleep cycle is broken, then in order to go back to sleep, we have to go back to the NREM stage again, and then go back to completing the rest of them. And if we cannot complete our 4 to 5 cycles at night, we wake up fairly tired, and we then need to have extra sleep during the course of the daytime. So again, if we go along with this sleep cycle, then our physiology is much better. Just to talk a little bit about the different sleeping patterns of children, I'll explain about how sleep changes from babies to teenagers. And if you keep your eyes on the central blue ribbon, you'll notice that right at the bottom, and you have the newborn, and the recommended sleep is about 14 to 17 hours. And anybody who's had babies will know that children at this age sleep most of the time. Infants between 4 and 11 months need about 12 to 15 hours. Toddlers about 11 to 14 hours. And then as they get older, preschoolers need about 10 to 13 hours. School age, 9 to 11. Teenagers, 8 to 10. And then about 7 to 9 hours of sleep. Of course, there are ranges, like everything else in life. You cannot dictate with just one number. However, if you stay within these ranges, then you're getting an appropriate amount of sleep. Just not to scare people too much, but also to remember that even if you have short-term sleep deprivation, it plays havoc with your brain and your mind. There is a lot of daytime fatigue. There is inability to concentrate. Your performance is decreased. Particularly for school-going children, they find it extremely hard, and in many instances, you'll find these children asleep at their desk. Memory problems and difficult behaviors in the form of irritability and so on. So this is only with the short-term deprivation. But if we go on at what happens with repeated sleep deprivation over longer periods of time, this really does have quite a profound effect and influences not only children's development, but their physical health also. So they have difficulty in modulating their impulses and emotions. So a very small stimulus can set them off and kick off, as they say, and they can be involved in altercations and aggression, uh, poor school performance, fatigue, memory difficulties we spoke about. There's an increase in sleep disorders. There's a higher risk of accidents. And then there are a lot of mental health issues such as anxiety, depression, aggression, impulsivity, poor concentration. And these are all, people will recognize that these symptoms are often seen with children who've got attention deficit and hyperactivity disorder. And along with this, some more physical health issues. The carbohydrate metabolism is affected quite big time, and risk of diabetes mellitus and obesity and a weakened immune system. And in today's day and age, particularly with COVID, the one thing that we have learned is that the immune system must be boosted, and so is able to cope with the difficulties of managing and getting rid of the virus from the body as well. So just to say a few things about babies. In babies, the sleep-wake cycle is not established, and this doesn't get established until about 6 months of age. And interesting thing is that research has shown that breast milk of mothers does contain higher levels of cortisol in the morning, just as we see this in the physiology that I showed you earlier, and it does show higher levels of melatonin in the evening. So already nature is preparing the baby for waking up early and then sleeping off.
Sleeping early.
Yeah. So just one or two things, that sleeping on the back is much safer. So better best to put them on their back rather than on their tummy. And lastly, I think that if there are smokers in the house, they must not smoke anywhere near the baby's room, because this is associated with sudden infant death syndrome. And those who do not know about this is most common in under 1 year olds, where babies can have a sudden breathing difficulty, and this can often lead to them perishing. Going on to toddlers, they are just starting to establish a sleep-wake cycle, and early sleep hygiene practices should be started, and the rest is fairly self-evident. These children are very insecure, so as you're putting them off to sleep, it's worth hanging around until they're well into sleep, so that they do not wake up scared and wanting more comfort. For the preschool child, it's very important that we have already started to establish a good sleep-wake pattern. The good bedtime hygiene routines should be followed, and daytime naps should be diminished. We know we really sleeping for 3 to 4 hours in the afternoon, which is the norm in our country, at least I think during the summers particularly, is not good, because what happens then is that they cannot go off to sleep at night. So short power naps is the best thing to do, and preparing for the school routine. For school-age children, they've already established, most of them should have a good sleep-wake adult type pattern, and we should be reinforcing these routines. Important over here is to realize that screen watching is very detrimental to sleeping, and what has been proved is that the blue light from phones and television and so on actively inhibits the melatonin. So the screens should be off at least an hour before bedtime. Important thing also is that the WHO recommends that during the day, screen time should be limited to 2 hours. And I can probably hear a lot of sniggers from children when they hear this, because 2 hours is really nothing for them. They're just barely
Nothing
getting
at
into.
all.
The less time they spend on the screen, the better it is, and the more time they spend in exercise and walk and social interaction with their siblings and friends and so on, the better it is for them. Teenagers, this is the most challenging age because sleep is the least of their priority. And
Exactly.
important thing is that one should emphasize the positives of regular sleep. It makes them very good looking. Their skin is free from spots. They're healthy. Their weight is healthy. They don't get fat. They grow tall. They have more energy. They're better memory retention. And as they get better grades, they're better jobs and more money to do whatever. But important don'ts in this are that they should avoid energy drinks. They should have the same bedtime routine every day. Exercise should be done in the morning, not in the evening or before bedtime, because that's when it really sets off more steroid, and it doesn't allow them to go to sleep. And
Hmm.
the bed should only be meant for sleeping and not for playing on. And a decluttered bedroom is considered to be a better place for them to sleep. So I think that a contract with a teenager for their own betterment and benefit is probably what we require. Um, now, if you look at sleep in a little bit more detail, there are those problems which are associated with going off to sleep, and these have their own particular solutions. Then you have another issue, and that is that children will sometimes go off to sleep, but they wake up about an hour or 2 hours later, and they have a different set of issues that need to be explored. And of course, not getting enough sleep. We've already looked at what they need and how many hours they need. And then lastly, the daytime sleeping. And keeping a sleep diary is sometimes extremely useful because it makes one realize just how dysfunctional our sleep has become. Um, some of the common sleep problems that I've certainly come across with parents, things like night terrors, people worry about these a lot. Night terrors really are quite innocent. And all you need to do is to reassure the child and just stay with them. An important thing is that if it does become very persistent, you can almost time them so that you can wake up the child about 10 to 15 minutes before they're due to get this episode, and slowly it will disappear. Nightmares and sleepwalking both happen in that rapid eye movement sleep time. So this often happen in the morning,
Hmm.
and again they are totally innocent, and children grow out of these. So knowing that is important. I think the important thing is that sometimes in nightmares, children will wake up quite frightened. Sometimes they look as if they're awake, but they're not really awake, and children and people wake them up. And that is the time when they need to be reassured, maybe just a glass of water or milk, and then go back to sleep. And that's not the time to start analyzing their dreams to see what the implication might be. And similarly, sleepwalking children, not at all uncommon, need to be just guided back to their bed, help them to go off to sleep, and they should grow out of it by adolescence. Restless leg syndrome is something that some of the parents may well have seen. Children are often very restless. They move their legs about, they toss and turn, and this really can be quite difficult for them. There is no real cure for this, and people have sometimes thought that they are associated with growing pains and so on, but there's no scientific reason for it. Sometimes massage and light massage with oil, little bit of stretching exercises. These tend to help. Rhythmic movement disorder, quite uncommon, but you do find some children who have this habit, particularly for those children who are not typically developing, that they will sometimes have problems like head banging or moving their trunk forward, backwards, or sideways. And again, this is something that typically growing kids will grow out of, but some others do not. And trying to distract them away from it earlier on does help. but it can be quite an intransigent type of problem and doesn't go away that easily. In addition to these, the other issues that sometimes we find are that children who cannot go off to sleep sometimes is because they've either had too much sleep during the day, or there's too much television watching, or that they have stimulant drinks. So avoiding those and then keeping with the same bedtime routine, a temperature of between 16 to 20 degrees in the bedroom is good, and encouraging children to wake up in the morning at the right time allows their whole cycle to be more normal and in line with the physiology.
Okay.
Uh, there, there are some sort of sleep hygiene messages. I think the important thing is that parents should fix a sleeping time for their children and stick to it, and don't vary that too much. It's important that the room is quite dark at night. The presence of the TV and video games within the bedroom is certainly very detrimental. An early meal, very important to avoid telling stories about which scare the children. Improve physical activity during the daytime is good. Room temperature I've spoken about, and afternoon siestas, not more than half an hour to 45 minutes. Important thing in the don'ts is that the house should be quiet. So don't turn your washing machine on at night. Avoiding screen watching, avoiding
So what
caffeinated.
about when some people, sorry for interrupting you, what about when some people say that we can sleep through any kind of noise?
Yeah, well, what happens is that sometimes people do say that, but
Mm-hmm.
the quality of their sleep is not very good. And you
Okay.
remember I showed you earlier the various cycles of sleep. So
Mm-hmm.
if there is constant noise and they cannot go through the various stages, they don't go into REM sleep, and that often leads to not a very relaxing and so on. So
Okay.
a few of these ideas, it's important to also think that if you've got a child with a sleep problem, then there's no black and white solution to it. So you have to gradually improve their routine, and it often bears the fruit because these things have been known to give us that benefit. I don't know whether, Rida, it would be important to go into the autism. I've been talking non-stop and probably turning everybody into sleep mode.
No, no, sir. No, no. We have questions, and I just want you to put it to all the viewers that all the comments that we are getting
Okay,
after the presentation is done, we'll go through the comments.
okay. So, do you want me to go through some of these conditions then?
Yes,
Uh,
definitely. And I would say autism specifically because we have like many children in our school as well, autism diagnosed, and I'm sure this would help them.
Well, autism is quite a common condition,
Mm-hmm.
and these children have a lot of associated difficulties, and sensory defensiveness to light and sound is quite common. And many times, children with autism cannot go off to sleep because they've got fixated with the sound of a ticking clock, or a shadow, or a light, or something. So it's important to not have these in the room, and if there is a clock, just turning the face away and replacing it with one which is very, very quiet. Some children need a bit more than the ordinary blanket, and weighted blankets have been shown to have more benefit, and an occupational therapist often will advise that. Um, they there is in my own experience, if you have children with autism, they often have problems of going off to sleep, and this is very, very melatonin sensitive, and
Mm-hmm.
it's not necessarily because their daytime routine is wrong or whatever, but they just seem to be more, they need a little bit more than just the straightforward hygiene measures. So If you've had a proper assessment through a pediatrician, an expert in development or neurology or whatever, they will often prescribe melatonin over a short period of time. Important thing is to know that you must reinforce melatonin with the good sleep hygiene measures, and helping to go off to sleep is certainly a part of this. The other thing is that a good 10% or so of children with autism also have associated ADHD and its inherent sleep problems. They also have more incidence of epilepsy. So a full assessment is required, and we need to know what the other comorbid factors are, or another associated factors with ASD, which give rise to their sleeping difficulties. Attention deficit and hyperactivity disorder, again, more and more being recognized nowadays. And their sleeping difficulties can be part of their disorder, or they can be part of or a consequence of the medication, because a lot of the medication that we use for ADHD, in the form of methylphenidate and so on, they're also stimulants. So important to remember that the dose of this medication must be catered in such a way that it doesn't reduce their sleeping. So it should be given in the morning, and and avoid the dose in the evening, because that's what keeps them awake. But it's a very fine balance between how much you give of the stimulant medication to improve their ADHD, so that it doesn't affect their sleep. Again, being aware of coexisting autism spectrum disorder and epilepsy. Sometimes kids with ADHD have a real issue with switching off, and this improves with giving the right medication for treating their hyperactivity as such. Um, Children with cerebral palsy have a lot of associated health issues. So a lot of them have reflux, where their food comes up from the stomach, up the esophagus, and into their mouth, and they often get pain because of the acid. So that can wake them up. A lot of associated problems with skeletal and muscular pain because of the stiffness. So treating those appropriately. And then particular types of cerebral palsy, particularly those in which you have writhing movements, such as in athetosis or spasticity, in other words, being stiff. So the treatment for those in its own right has to be done to prevent these kids from waking up because of pain. Stopping breathing or sleep apnea because of the weakness of their muscles in the pharynx is quite common. So being aware of that, and making sure that they're on their side if that happens, and if need be, appropriate devices to help them breathe properly, and to have some sensitivity around the propensity for apnea is important. I think assessment and involvement of ENT surgeons in this respect is good. Then pressure sores can be a source of pain and discomfort. So being aware of that, and a full examination to identify and treat these appropriately. Hunger and thirst, very common in children with CP, because they cannot often make their own needs known. So somebody else has to be aware that they have not had enough food or drink. So it's so important to make sure that they are fed properly and there are enough calories in their system. Um, Being aware that some medication will cause sleeping difficulties, and of course epilepsy. So cerebral palsy is one of those conditions which really does require a full multidisciplinary and in-depth assessment by an expert, so that all aspects of their management can be tailored to suit the child. Um, Children with Down syndrome have particular problems. One, that their airways, right from their nose right down into the lungs, are quite narrow, and they're very easy to obstruct. So being aware of that, Secondly, they have very poor muscle tone, and that leads to the collapse of these airways. And this is often associated with waking up with sleep apnea. They also have reactive airways. So in other words, they can react with narrowing of their airways to changing seasons, to spring, or to infections, and so on. And there is, of course, association of ADHD and ASD with Down syndrome too. So being aware of this particular of their particular risk factors requires a full assessment so that sleep too is catered for, along with all the other aspects that we need to think about. So, in a nutshell, I think the important take home message is that, there are important good sleep hygiene practices that can really make a big difference. And if you start to put these in place as soon as the babies are born, you will encounter less of a problem. But also, when you do go in for any medical consultation with your pediatrician, if there is any issue at all with sleeping, do please raise this in the medical consultation. Research has shown that even with parents who've got children who are not sleeping at all, they will fail to raise these issues with medical consultation, either because they think that it's not important enough, or because they think that there isn't much that can be done about. And clearly, there is a lot that we can do. Sleep disorders can be investigated. There are sleep pathologists, there are ENT surgeons, there are others who can really help you to identify, pediatric neurologists similarly. And there is medication available. But medication is really for the very small proportion who are resistant to all the other measures. And melatonin is one of the medications that can be used over a short period of time to reset our sleeping switch back to normal. Of course, there are other sedative type medications too, but their use must be governed by prescription only. And avoid self-prescribing, because as you get used to these, you need to have increasing doses of the medication, which leads to the children being extremely groggy in the morning, and their overall functioning is not very good.
Do you
So,
become resistant to that medication?
pardon?
Does one become resistant to the sleep medication?
What happens is that if you start getting used to say, a common medicine that people use is a form of diazepam or lexotanil, and what happens with this is that initially, if you use it for anxiety, for example, it is
Mhm.
beneficial. But as you start to use it for long term, then for this to get the same effect, you need higher and higher dosages. The body gets used to it, and it hangs around in your system in such a way that in the mornings you still have a lot of this moving around and affecting your awakeness, your ability to concentrate, and so on. So your body gets used to it. The effect is not the same with the same dose. So you have to increase the dose to try and get the same benefit. But along with that benefit, you also start to get a lot of toxicity. So really, coming back to the sunshine, I think remembering that the morning time is the best time, and I think important thing is to try and wake up early to benefit from the good sunshine and let that enter your eyes and brighten your brain and your day. And if you start well in the morning, then if you wake early, you sleep well and you stay healthy. So. This last bit is really I've written a little a pamphlet. Really, it's quite small. It's about 17 odd pages. It's available on the web, and I've tried to put what I've learned from parents about their children. and what the research suggests. So it's something that some of your audience may wish to explore, to look in more detail for answers that they need. So
Mm-hmm.
I'll stop there, and we can take any questions or whatever.
Yeah, okay. So the first that because sleep problems, but every sleep problem is not like a sleep disorder, right? So how would people go about diagnosing a sleep disorder? Like I have questions such as how do I know if my child has a sleep disorder? How early can it be diagnosed? If you could shed some light on that.
So I think knowing first of all what the normal pattern of your child should be, and
Mm-hmm.
in the course of this talk, I've talked about the normal patterns of sleeping for babies and toddlers and preschool children and school agers and teenagers. So I think first of all, knowing that pattern is important. I think the second thing is knowing how much sleep they need in 24 hours, and being aware that those are important. Now, people who've researched sleep, they say that if your child is needing more than half an hour to sleep, then
Mm-hmm.
you have a problem. And they need to look at the sleep hygiene. They need to look at the routine that their child has got to try and address that. Secondly, they also say that if your child is waking up for more than 2 or 3 times in the night and staying away for like 20 to 30 minutes each time, then there is an issue which needs to be explored. And it could be that they have a breathing issue. It could be that they're in pain. There may be a reflux. There could be so many things which wake them up. Physical health issues which are quite easy for pediatricians to diagnose and treat, which really stop the children from waking up. So I think knowing those two things, that A, going off to sleep late, and
Mm-hmm.
number two, waking up frequently at night, and knowing the difference between the two, and knowing also if the overall time that they're asleep in 24 hours, according to their age, is outside of the limits, is quite important. Um, and you can of course reference it through but there are so many there's so much information available. But if this is happening on a persistent basis, then it's quite crucial that people should seek advice. And I would encourage people to go to pediatricians to raise this issue, to have it properly explored, rather than try and treat it themselves.
Definitely. So we have a question in the comments. Haneen Saif is asking, my daughter, 2.5 years old, does not sleep through the night if she sleeps before 1 or 2 a.m. I have tried everything from no nap, more exercise, lesser daytime sleep, etc. She is also suspected to be on the spectrum on mild level. She sleeps throughout the day. So, any comments on the situation?
Yes, I mean it sounds as if there is an issue that she actually does not seem to sleep before 1 or 2. So there is a problem with going off to sleep, first of all. And
Mm-hmm.
that falls into the first category that I spoke about. And, for these children, along with the really good sleep hygiene measures, and if this is persistent, then I think a visit to a pediatrician, and maybe considering a short course of melatonin is perhaps good. Having said that, for the if she's worried that she may be on the spectrum, I think it's quite important that that is explored, and
Mm-hmm.
a diagnosis sought for that. Because if she is on the spectrum, then looking at the associated factors as well. But she is only 2.5, and melatonin itself is used for slightly older children.
Okay.
But I think the important thing over here is to look at the overall picture, and look at somebody needing to go over the physical health, see if there is a breathing issue associated with it, see if there's a reflux issue. Is she constipated? Has she got any pain from somewhere else? So I think a full assessment is required to look into it, and also, to see how she has got into this sleeping pattern. Was it always the case, or is this something that has developed over time? And if it is a recent occurrence, then looking at what the causation of it is. So, I think certainly if it is a persistent issue, then a good consultation and assessment is required for this.
Okay. Another comment that we have is, okay, very valuable advice and information on sleep issues. UNICEF survey in 2019 showed a high percentage of children under 5 were malnourished. In our poor communities, we encounter stunted growth with malnutrition. In my practice with children with disabilities, one problem for sleep is hunger. Poor ability to swallow and take in enough calories in a timely manner is often a problem for children with cerebral palsy, for example. We have had good results after a feeding program for better sleep patterns. And the UNICEF survey was conducted in Pakistan. So, feeding
I,
patterns, feeding programs.
yeah,
Yeah, what would you say about that?
I think this is so right, and of course,
Mm-hmm.
Yvonne has got so much experience in this area, and as you know, she's the lead sort of person at Akbar Care Institute in Peshawar, where I've had some interaction, and I've seen some of
Mm-hmm.
their kids too. Uh, I emphasized earlier on about cerebral palsy. There is absolutely no doubt that because children with cerebral palsy have often got swallowing and chewing problems, that they're not given enough food, because the time they often take to feed the right amount of calories is much more than what you would expect other children who do not have this condition. So parents may not realize that they have to allow for a much longer period of time. Number two, I think it's important to also determine through the work of speech therapists and speech pathologists, or through other therapists,
Mm-hmm.
what is the precise texture of the food that these children can manage. Remember that when you have something like cerebral palsy and your swallowing mechanism is not so good, then you cannot handle very runny, very liquidy food. So having a slightly more thickened food, with a slightly more manageable consistency, as in porridge, or khichdi as we call it. That is another good example too. So trying to find the right texture is quite important. I think also recognizing that food from the stomach up into the esophagus is very common with children with cerebral palsy, and that often leads to pain, and that pain leads to these children actually refusing food, because they realize that as soon as the food goes down, that they are going to get reflux, and they have a problem, and they will have pain. So sitting them up is important. So the right posture, not to feed these children lying down. I've seen many a child with CP being fed when they are lying down, which is absolutely the wrong way to do it. So sitting them up, so that and giving them the time, feeding them slowly, making sure that if they are swallowing, that they have actually swallowed and the food has gone down, and giving it in small boluses. It requires the patience of a saint to feed these children, but it is very, very important, and it can be done.
Definitely.
Of course, there are those children who also have problems with not being able to manage the bolus in such a way that it goes straight into the stomach, and they can sometimes aspirate. So trying to find out if the food is going into the lungs, and giving them aspiration is important. And we sometimes think that if it's going down into the lungs, the child will cough, or they will be able to cough it out, and so on. In the case of a lot of these kids with cerebral palsy, it's not always the case, and you can have what is called silent aspiration. So over time, small amounts of food does keep going down the wrong way, and this leads to a compromised lung function. So their breathing is not very good, and they can get infections in their lungs. So they have what is called aspiration pneumonia as well. So for these particular children, there is a comprehensive assessment, such as the one that they carry out at Akbar Care Institute, is important. And I think being aware that nutrition can be a very big issue with them. And research has also shown that when you feed these children enough calories and they have more flesh on their bones, and there's more nutrition for their brain function, that their developmental progress also improves. So their, for example, speech and language development and other aspects of their development also benefits tremendously. So I think being aware that these children may be malnourished, and the malnourishment not only affects their overall stature and other things, but also affects their mental function, because the brain needs more calories than one realizes, and you need to have that awareness for the brain to function. So, thank you, Yvonne, for bringing this up. It's an area that's very close to my heart, and I've certainly dealt with a lot of these kids who got problems, and it's often an unseen problem. We sometimes are not aware of it.
She has also brought up another interesting point in another comment. I'm just going to put that up. The parents' sleep habits can influence children. What is happening in the home at the time we expect children to settle? Does the child sleep in the parents? I can affect sleep. It's complicated. So yeah, family situation is very important. We have to make sure that everything is all right.
Absolutely. And, we often think only of houses in which we have 3 or 4 bedrooms. But in fact, most of the population of this country are living in a single room
Hmm.
accommodation. And if you can imagine a family of, say, 3 or 4 children and their parents all trying to go off to sleep in the one room, then the sleep habits of the whole family impinge on the child as well. So
Yeah.
I think the whole family has to, just like if you're trying to implement a particular diet regime within the house, you cannot do it for one child or 2 children. You have to implement it for the whole family. So if the whole family follows the appropriate sleep and wake cycle, and they all follow the nighttime pattern of eating early, eating a very light meal at night, and then perhaps just some social sort of chit chat, some stories, and so on, and then having the light down, and then everybody going off to sleep at the same time. So I know these things are probably very easy to say, and they are incredibly difficult to implement, because the reality of life is that if you're a father of 3 children and you have your own business to run in Pakistan, businesses don't start functioning before 11 o'clock in the morning. But when you arrive there,
Yeah.
then they don't close until late at night. So the father will sometimes come home at 11 o'clock, and when they come home, the whole family is in most instances waiting for them, because they want to have food with their father, and the children are
Hmm.
waiting to see their dad too. So it's not easy, but it is manageable. And the only thing that I can offer in this respect is that if we all make an effort and try and start our day earlier, then the parents can also, the fathers can also try and get home early enough so that they can go off to sleep. And it might be too ambitious to think that everybody should be in their bed by 10 o'clock. But if you start to make an effort, at least you shouldn't be going to sleep at 2 o'clock in the morning, which is in most instances the case, and then waking up at
Yeah.
10 or 11. So I think being aware of the detrimental effect of sleep deprivation, and of missing that morning time,
Hmm.
when the cortisol levels are high and our energy levels are better. I think being aware that trying to do things in the evening when your cortisol levels are low is not at all best. And you're fatigued, your brain doesn't function so well, you're irritable, you're more likely to get into quarrels and aggressive behavior. So I think sticking with the way nature has intended us to work, and starting our day early and having our rest appropriately really does help. And if you stick with that rhythm of life, then it does affect all aspects of your life.
Definitely. So, of course, we need to go to sleep early and then wake up early. However, if we don't do that, and we need a set amount of uh, hours of sleep to function properly. But what I want to ask right now is, okay, what's worse? Say, going to sleep late and getting up early, or going to sleep late and getting up late?
What's worse?
Yeah, what's worse?
I I think that there are two things in this. One is
Mm-hmm.
that you need to have a continuous sleep where you get your 4 or 5 cycles of 90 minutes
Mm-hmm.
each, so that you can touch that magic rapid eye movement sleep. That aspect of your sleep is the one that really does rejuvenate you and sorts out the balance of the neurotransmitters in your brain and so on. So you need to get into that zone, and for you to get into that zone, you need to be sleeping at a reasonably early hour, and therefore and for sleeping for long enough. And the duration that you need really does depend upon how old you are. And whereas for the adults, anything up to 6 to 8 hours of sleep will mostly suffice. But if you're a young sort of pre-teenager, so you're a 12-year-old, you do need your 10 to 12 hours of sleep. You cannot. And if you have less time to sleep, then you are not able to touch that REM sleep adequately, and that affects your whole day, your concentration, and so on. So it's a rock and a hard space. The choice is not good. You have to have it's better to sleep early and to wake up early. If you do go to sleep late, then perhaps try and get up earlier, and
Mm-hmm.
um, and then try and set your rhythm of sleeping right during the daytime. Try and avoid a very long sleep in the afternoon, and try and sleep a bit earlier at night so that you can go to sleep. So trying to stick with that routine is what I would recommend.
Okay. So another question from the comments. Imran Durrani is asking, does use of electronics just before sleep affect sleep patterns like use of mobile phones, laptops, iPads, etc.?
Thank you, Imran, for this excellent question. My pet hate is the is the whole issue of watching screens. And I know now that a lot of mobile phone manufacturers have got a different mode, and they
Yeah.
claim that if they have this sleep mode, that this doesn't affect them. But the point is not so much that you don't have the blue light which switches off your melatonin. The point also is that if you're using electronics, your screens and so on, um, they if you're playing games, for example, um, on your mobile device, it does stimulate your brain too much, and
Mhm.
going off to sleep in the after you've been playing uh, is that much harder, so it takes you much longer to go off to sleep. And the WHO recommendation of trying to stick to about 2 hours of screen watching per day is for this very reason, because it does really, particularly if you watch screen in the evening, it does affect you very badly. So avoid this at all cost. It certainly makes really it does cause a lot of sleep pathology.
Sleep. Okay.
And of course, Imran knows all about it, being a professional who's been working in the field of electronics and mobile devices.
Okay, okay. So I remember a few years ago, I read an article. Now at that time, uh, being young, I didn't know okay how to see if the an article is just something on the internet, or if it's verified by researchers or something. But it was about okay, how one gender needs more sleep than the other gender. So I wanted to clarify: is that the case? Is there any difference of need of sleep between the genders, or both need equal sleep?
Yes.
Okay.
Yeah.
Yeah.
Uh,
It
it,
was,
yeah. The thing is that it all age has certainly been found to determine how much sleep you need.
mm-hmm,
And
mm-hmm.
there is a range. If you go back to that slide that I put up earlier, if you look
Yeah.
at that, there is a range. And I know many people who adults who need barely 6 hours or even 5 hours of sleep a night, and they're enough with that, and they have no problem. They have that 5 hours, and they go into really deep sleep. They wake up fresh, and they're away, and they have a lot of God has given them a lot of energy, and they're like a real powerhouse during the whole day. So they are the lucky people, and
And
they're
at
the
the
ones.
moment, we don't know why that is. Okay, some people
No,
don't try very well.
there is some research to show
Okay.
that your genetics can often determine this, and there are particular genes which make you into a skylark. They describe two types of people. They describe those people who are skylarks, who sleep very short time, but they wake up and their eyes just go bing, and they open up totally, and they have a lot of energy, and they're straight into work mode,
Yeah.
and they keep going at full throttle, and then suddenly they run out of steam, and they go to sleep at night. And then there are those who are the night owls, and the
Yeah.
night owls are what most of the people are. They will
Mhm.
stay awake at night. They'll watch one episode of Earth, and then they got their need to watch another episode because it's ended at the point where there was somebody was just going to do something very different,
Yeah.
and they were waiting to
Cliffhangers
see,
are the worst.
and then you want to see another one, and before you realize it, you're already at 2 o'clock in the morning. And then when you go off to sleep, you've had this period, you go your brain is still working in the that particular series, and you unwind very slowly, so you remain tired, and you're not really refreshed when you wake up in the morning. So if you have to wake up and then go off to work, or wake up for
Yeah.
whatever other reason, you haven't had your full 4 or 5 cycles of sleep, and you end up with a very tired brain, and not being able to function very well. So if you have been blessed by Allah, and you have the ability of a skylark, then that's wonderful. You're probably a very productive individual who only needs 5 hours, and who can really be very productive. And these are the people who are often leaders in our society. These are the big the real they're in small number, but they are very incredibly important.
Exactly. Okay, so I also wanted to ask you, we've also heard, okay, some people are afraid of sleeping. I think it's called sleep anxiety. Can you touch upon that?
People who become anxious about sleep often do so because they sometimes experience nightmares,
Mm-hmm.
or they experience sleep apnea during their sleep, and they wake up, or they've had bad experience, otherwise. But mostly it's an association of going off to sleep and then having a bad experience of that, and they then misconstrue that as that they've had a visitation from something, or something else has happened. So it's important, if they do get sleep phobia or sleep anxiety, that they analyze that appropriately to see where it has started from, and
Mm-hmm.
also to then understand what that involves. And I think a comprehensive assessment, if they have got sleep apnea, which is more common than people realize. And what happens is that you go off to sleep, you're fine. As soon as you relax enough and the muscles in your throat relax and they start to block off your airways, you cannot, you cannot breathe so well. So you start accumulating carbon dioxide in your brain. You start getting a sore head, and ultimately you wake up with a sore head. You might have had a nightmare as well in the process. And if you start getting that every day, it really does give you such a negative feedback that you're actually afraid to go off to sleep, because you know that during the course of the night this is going to happen to you. And as this happens, you end up with pain and discomfort. So if you get this assessed and you go to a sleep pathologist or an ENT surgeon who can do a good sleep study, and they can tell you that you have got an upper airways obstruction problem, they can resolve this for you. And it's not always the case that you need surgery. There are devices that can help you breathe. There are you know which can keep your airways open. There are CPAP machines, and there are various other things which can help. But you really, I think one of the important messages that I want to give really is that if you do have a serious issue with sleep, then don't just try to treat it yourself, because there is good expert opinion available, and there are very effective treatment regimes which really do help these people, and it can make a huge difference to their lives, because suddenly when this is treated, they wake up refreshed, and their productivity goes up. They're not depressed or anxious anymore, and they suddenly they almost feel as if they have been reborn, because they are so awake and so alert, and they're able to understand the same issues. And I've seen this with kids, particularly children with Down syndrome, who've had large adenoids, and with their small airways, once the adenoids have been removed and they're breathing so much better, their speech starts to come on much more, their ability to socially interact, their ability to learn. So all those things start to fall into place, and it's often an unrecognized area, which is why I think it's important that we remember to ask about this when we see these children as pediatricians, but also for parents to remember to ask about this when they go to consult their doctor, because there are really treatments and management available which can make a big difference.
Okay. So I suppose I would like you have given a variety of advices. So usually I say, okay, what's your advice gonna be before I end? So let's just say any final words for today, sir.
No, I think thank you for having me, and I'm sorry if I've been rambling on too much. You got me on a topic that I'm interested in.
No, no,
Uh,
so definitely it was amazing to have you, and I'm sure the audience really enjoyed. We have some comments about how. Let me actually put them up. So Tahir Niazi, thank you for your comment, and he's saying very good presentation. And Aisha Durrani is saying excellent and knowledgeable presentation. Thank you so much, Aisha, for your comment. So yeah, I think this went really well, and people are going to definitely benefit from it, especially with the guide you shared with us that I have put in the comments. The link is in the comments. I'm showing you the link, everyone. So you can just click on it, and the guide will appear, and you can download it for your
Lovely.
use.
Thank you very much, Rita, and perhaps we might see some difference in the sleeping pattern of children. We hope.
Inshallah, definitely. We can do is hope and pray. So once again, thank you so much for joining us, sir. It has been a pleasure, and thank you to all the viewers for joining us. Thank you so much for your comments, and just know that this session will be available on Facebook, and we will also upload it on our YouTube channel. You can also go there and see all our previous live videos if you wish to. Thank you so much.
Okay,
Allah
thanks.
Hafiz.
Assalamu alaikum.
Wa alaikum assalam.